With the uprising of cases of COVID-19, senior citizens are the most impacted because they are the most vulnerable. There are two main points why the elderly population is more prone to infection than younger generation. Firstly, senior citizens are more likely to suffer from pre-existing conditions such as cardiovascular disease, diabetes, or respiratory illness, and have underlying conditions that hinder the body's ability to cope with and recover from illness, such as chronic obstructive pulmonary disease. Secondly, as older Americans age, their immune systems change as well, developing weaker immune systems that lead to having issues fighting off infections. Even though elderly people are considered most vulnerable, they are not the most prioritized in the eyes of the general public. A significant factor in prolonging isolation within the senior community is the targeted ageism directed from younger generations. Across the internet, younger generations of America have referred to the coronavirus as the boomer remover. This term became a trend after originating on the social media platform Reddit. An interview conducted by Insider magazine with 21-year-old Ava Louise describes how she contributed to a coronavirus challenge by licking a toilet seat on an airplane. She states, "I've been very open about hating older people, and I grew up in this internet culture they don't seem to grasp. They refuse to change or grow or adapt." One woman from Tennessee protest held a sign that read, "Sacrifice the weak," advocating that those who are more likely to die from the virus, such as senior citizens, should be seen as collateral damage in a bid to rescue the economy. Seniors who see these verbal attacks are dealt with more stress and choose rather to stay inside and not be confronted by ageist Americans. Forbes reported in late April that older Americans with higher salaries were facing mass layoffs because their employers may have seen them as lacking technological skills and being less proficient in a remote work environment. Ageism within the older population shows negative signs on health. Research has shown that ageism causes cardiovascular stress, lowered levels of self-efficacy, and decreased productivity. It also suggests that older adults with negative attitudes about aging may potentially live 7.5 years less than those with positive attitudes. Many Americans fail to realize that ageist rhetoric causes seniors further stress, both adding onto stress from social isolation while simultaneously increasing the prevalence and health effects of social isolation. Ageism has taken place even in political settings. California Governor Gavin Newsom had expressed that there should be a stronger focus on the younger infected population, rather than the older one. He was criticized for this statement. More recently, however, Newsom attributed the surge to coronavirus cases in California to younger people who might believe they are invincible, but who are nonetheless becoming sick from COVID-19 and potentially spreading it to the more vulnerable. Earlier this year, it was reported that across the nation, hospitals, not nursing homes, were to be the primary focus of COVID-19 healthcare priority. Nursing homes have had a delay in receiving personal protective equipment, resulting in thousands of staff losing their lives. Jane Keller, Vice President of Senior Living at Capella Living Solutions, has stressed that nursing homes are desperately searching for personal protective equipment and have had to resort to alcohol distilleries to replace hand sanitizer and order ponchos from Amazon to use as gowns. 9 to 11% of patients in long-term care facilities have tested positive for coronavirus. According to a New York Times database, at least 57,000 residents and workers have died from the coronavirus at nursing homes and other long-term care facilities for older adults in the United States. As of July 15th, the virus has infected more than 316,000 people at some 14,000 facilities. A nursing home from New York City had been forced to use a refrigerator truck as a mobile morgue because funeral homes started becoming overwhelmed by the number of coronavirus deaths. Mayor Bill de Blasio has regarded the crisis in the Isabella Geriatric Center in Manhattan which hosts 705 beds and has reported 98 resident deaths due to COVID-19, as absolutely horrifying and impossible to imagine for just one long-term care facility. The Andover Police Department from New Jersey received an anonymous tip about a body being stored in a shed outside Subacute and Rehabilitation Center, one of the state's largest nursing homes. When authorities arrived, the body had apparently been removed from the shed, but it led to the discovery of 17 bodies piled up in the nursing home's morgue, which only had the capacity to hold no more than 4. Governor Newsom's administration had an approved plan to pay nursing homes for housing confirmed coronavirus patients has yielded some grievances. In late April, a guidance memo from the state revealed the lack of proper coronavirus testing when patients from hospitals were transferred to nursing homes. In fact, the state specifically forbids nursing homes from requiring much testing, adding on to the difficulties of patients and staff alike. As the unfortunate reality of this virus's effect on seniors continues to negatively impact them, it is clear that the steps we as a society need to take start with individual responsibility.